Fantastic. Okay. Let's see. I'd like to go ahead and call this meeting on January 10th, 2022 to order. And for everyone who can, please rise for the Pledge of Allegiance. Mr. Bishop, will you lead us in the pledge?
Pledge allegiance to the flag of the United States of America,
to the republic for which it stands, one nation,
under God, indivisible, with liberty and justice for all.
Great, thank you. And let's see, going to roll call.
Yes. The chair, Joseph Diver,
Here.
John Boyle,
here.
Mark Strout,
Here.
Robert Bishop,
Here.
Dan Esco,
Here.
and our town manager, Thomas Hutchinson.
Here.
Awesome.
There's a few people included on our participants list. I don't know. Laptop 314. I'm not sure if somebody could identify that person themselves.
It's Carolyn.
Oh, okay, there it is. It changed. Thanks.
All set, Brittany? All set. Okay. And just a reminder that since we haven't been on Zoom for a while, that we will have to do roll call for each vote. And with that, we'll go to the minutes of November 8th, 2021. If I can have a motion.
Let's see. Right first. Make a motion to accept the minutes for November 8th, 2021 as presented.
Is there a
Second.
second? A second by Mr. Strout. And roll call vote, Brittany?
Sure. Chair Diver,
Yes.
Mark Strout,
Yes.
John Boyle,
Yes.
Dan Esco,
Yes.
and Bob Bishop.
Yes.
Great. Thank you. And November 29th, 2021.
Make a motion we accept the minutes for November 29th, 2021 as presented.
Is there a second?
Second.
Second by Mr. Strout. Motion is second. Any discussion? Roll call vote.
Joe Diver,
Yes.
Mark Strout,
Yes.
John Boyle,
Yes.
Dan Esco,
Yes.
Bob Bishop.
Yes.
Great, thank you. We did get another set of minutes in that did not make the agenda, so I'll ask that we postpone that to the next meeting. Those will be the minutes from November 22nd.
So moved.
Okay. Public address to the board. This is a time when the public may address the board on any item listed on the meeting agenda or on any issue or matter of the town. If you intend on addressing the board at this time, we ask that you do the following. Please identify yourself by name, address, or the company institution you represent. Public address to the board segment will last no longer than 30 minutes. Please make your comments concise and try not to repeat statements made by others. Please address your comments to the board chair. Discussion or debate on any issue may not take place at this time. The chair, the designee, may answer questions on procedural matters. Please be cordial and respectful of others. If anyone wishes to be recognized when the board discusses an agenda item, please make that request at this time. The board chair may grant this request, address comments to the board chair, and be concise. And sorry for my dog. Anyone? I can't see all the folks on the list here. So there is, I believe, a raise hand option.
Yes.
Um,
Can you hear me okay?
Oh, Gail, yes. Okay, I can
Yes.
see you on my screen. Yep, hi.
Okay, thank you very much. Thank you, Mr. Chairman and members of the board, for the opportunity to address the board. My name is Gail Yates. I live at 79 Norwich Drive in Dalton. That's in the Greenridge area, for those of you who might not know. I did come before this board several years ago, pre-COVID, and I brought a petition with about 50 signatures and a whole packet full of photos showing the absolutely deplorable road conditions of our area and our development. And since that time, in the intervening 2 years, 2 of our 4 roads have been repaired. Unfortunately, the other 2 are still in a really horrible state of disrepair. I do have photos that I can show you here. They're not really great. If you share screen, I can show them to everyone. If not, I can actually drop these off. But as you can see somewhat from the pictures here, there are so many problems in our area. And these were taken the day after Thanksgiving, so late November. And there are huge ruts. There are stones sticking out. It is extremely unsafe. When I was bringing my grandson around in the stroller, no problem, because it put him to sleep immediately, which is great. But the poor senior woman who lives across the street from me, who has lived in this development her entire life, cannot even leave her driveway because the roads are so bad. She can't even walk with her walker because she can't feel safe. And I think that that's a shame for what we're doing. I would like to know when the board or when the town actually will consider finishing the job that it should have finished. This development has not been completely repaved since it was originally created way back in the 1950s. It hasn't been repaved since then. So I'd like it if the town would actually take a look at that, and we'd all appreciate it. My neighbors keep nagging me to come back before the board, and I will be here each month until I get an answer for them. They've kind of appointed me spokesperson because I bothered to do the petition and bring it before the board. I would really appreciate it if you would give that some consideration. And thank you for your time.
Great, thank you. Thank you, Gail, and thank you for bringing that concern to the board. And if there's no objection, Mr. Hutchinson, I'll defer that question to you, and maybe we can get an update from our highway superintendent at an upcoming meeting.
Absolutely.
And then Gail, I'll take the ownership, to make sure we just close the loop. And I'm sure Mr. Hutchinson and our highway superintendent will certainly do that as well. So
Thank you. I appreciate
there's
it.
there's one thing that a suggestion or something that'll be very helpful to small towns is that when it comes to, and this is just an opinion, folks, so feel free to chime in and just share this with our community. We really rely on funds from the federal government for road repair, and that fund is very limited to what we do receive. So if there's conversations we can have with state reps on that as well, would be helpful as we look at our funding strategies moving forward. So just a thought there, but we certainly will close the loop with you as well.
Thank you.
Sure. Anyone else from the community? I can only see a limited number of people on my screen. So Alyssa, if you can help me with any hands raised, and you're on mute.
I don't see any other hands raised.
Okay, great, thank you. And for that, I'll go ahead and close out that section of the public address to the board. Moving to number 6, appointment ratifications. Mr. Hutchinson.
Yes, first I'm very pleased that the Board of Health has forwarded a unanimous recommendation for Amanda Staples, Doctor of Osteopathy, to join the Board of Health. And I recommend that the board ratify this appointment. She's with us tonight, if you'd like to say hello.
Great, thank you, Tom. Hi, Amanda.
But she's on mute. There we
There
go.
you go.
Hi, everyone.
Well, thank you so much for stepping up and helping us with the Board of Health. And if you can share a little bit about who you are and the background, but we welcome you to the Board of Health. Sure.
Sure. I moved to Dalton in 2019, rather serendipitously, I guess, before the pandemic. And we have 2 young kids. My oldest is 5, so he'll be joining the Dalton school system in the coming years. I have been living in the Berkshires for the last 11 years. I did my residency training at Berkshire Medical Center. So I did my clinic down in Great Barrington and have settled here. I'm still involved in the residency program as associate program director. So I split my time between there and seeing patients in Lenox as a primary care doc.
Great, thank you. And with that, is there a motion to accept the appointment? Mr. Bishop?
I make a motion to appoint Amanda Staples Overman to the Board of Health effective on January 11th, 2022 through June 30th, 2022.
Second.
Motion is second. Any discussion? Hearing none, roll call vote. Brittany?
Hi, sorry. Joe Diver,
Yes.
Bob Bishop,
Yes.
Mark Strout,
Yes.
Dan Esco,
Yes.
and we have lastly John Boyle.
Yes.
Great. Amanda, thank you so much again for putting your name forward and your interest forward, and we look forward to working with you and collaborating with you and the Board of Health. And thank you for taking on that leadership role. Really appreciate it. And yeah, I certainly can't say enough for Dr. Doyle and Jane for the great work that they did, especially during these crazy COVID days. So again, thank you for stepping in there. Anything we can do to help you, certainly let us know.
Absolutely. Thank you.
And just so you know, all the appointments initially for the Board of Health are made to the end of the fiscal year. That's why you're being appointed to June 30th. And then July 1st, it'll be for the entire fiscal year.
Got it.
And thank you for choosing the town of Dalton for your new home. So welcome on that as well. So
Thank you. Very happy here.
excellent. And then the next one, Mr. Hutchinson.
Yes, we have 3 appointments for burial agent. This came up before and there was some lack of clarity about who was appointed to what. We have now confirmed that there are 2 full burial agents, and that should be the town clerk and the highway superintendent. And also there is an alternate burial agent, and that is the chief of police, in case those 2 are not available at some time.
Great. And with that, could I have a motion?
Sure. Mr. Chairman, I make a motion to appoint Heather Hunt effective January 11th, 2022 to the town election of May 13th, 2024.
Motion, is there a second?
Second.
Second by Mr. Strout. Any discussion? Hearing none, roll call vote.
Joe Diver,
Yes.
John Boyle,
Yes.
Dan Esco,
Yes.
Mark Strout,
Yes.
Bob Bishop.
Yes.
Excellent. Thank you. And thank you, Heather, for taking on that position as well. And anything we can do to help you with that, let us know for sure.
Super. Thank you very much.
Thanks,
And the
Heather.
next one, Mr. Bishop.
Sure. I make a motion to appoint Edward Bud Hall effective January 11th, 2022 through June 30th, 2022 as a burial agent.
Second.
Motion, is there a second by Mr. Strout? Any discussion? Hearing none, roll call vote.
Joe Diver,
Yes.
Bob Bishop,
Yes.
Mark Strout,
Yes.
Dan Esco,
Yes.
John Boyle.
Yes.
Great. Thank you. And thank you, Bud, for taking on that position. Appreciate it. And the next one, Mr. Bishop.
Sure. I make a motion to appoint Chief Deanna Strout as an alternate burial agent effective January 11th, 2022 through June 30th, 2022.
All right, motion, is there a second?
Second.
Motion and a second by Mr. Strout. Let's see, roll call vote.
Joe Diver,
Yes.
Dan Esco,
Yes.
John Boyle,
Yes.
Bob Bishop,
Yes.
Mark Strout.
Abstain.
Thank you all. And moving on to number 7, sign the real estate closed and sealed documents for 16 Gulf Road. Mr. Hutchinson?
Yes, of course, we're meeting virtually now, so we'll be unable to sign today. However, I believe Ms. Valley, who is here with us tonight, has documents that are signed on her end that she's going to bring over to town meeting. Now, we are supposed to have those notarized, so we will be on the hunt for a notary public in town hall who is personally acquainted with the select board members, if that is possible to be found. And we'll make it work one way or the other. And we should have those documents in the select board room for you tomorrow. Do we have them already, Alyssa?
No, Caroline's gonna bring them by tomorrow.
Okay, great. after the vote. Very smart. Thank you.
Great. Carolyn, would you like to say a few words or anything you want to share?
Yeah, I'm super excited about this. It's been a long time in coming. I did send Alyssa a picture of the drawing of what the house is going to look like in case we want to put that up, unless you want to share a screen and I can put it up just so that everybody can see that we're going to be starting to build as soon as we own it. So we're super excited about it, and we're hoping COVID settles down so that we can start having volunteer groups get started as soon as possible.
Are you guys able to see that picture?
Yeah, that looks great.
Okay.
Any comments from the board?
Yes, it's great. This is a great thing, and thank you for doing this. And it's just another plus for Dalton. So, it
And
looks-
I can walk there from my house because I am a new Dalton resident as of last March.
Oh, awesome. Again, thank you to you for choosing Dalton. That's great news.
Yeah,
Awesome.
we're happy.
Fantastic. Well, this looks beautiful. It's going to be a great home for the family that's selected. So
great.
we're excited for this. Absolutely. So Mr. Hutchinson, do you need a vote on the agreement yet, or do we wait on that? What's next step?
Yes, a vote to sign the closing documents to sell 16 Gulf Road would be very much appreciated.
Is there a motion?
I make a motion to sign the papers to sell 16 Gulf Road.
Second.
Motion is second. Any discussion? Hearing none, roll call vote.
Joe Diver,
Yes.
Mark Strout,
Yes.
John Boyle,
Yes.
Dan Esco,
Yes.
Bob Bishop.
Yes.
Excellent. Thank you. And looking forward to signing those papers and moving that project along. And thank you again to the Berkshire Habitat for Humanity for helping us and certainly helping another family come to Dalton. I think it's going to be certainly a great project and looking forward to the family moving in. So. Let's see. Moving on to number 8, the pay and classification study, presentation by Carol Granfield, if I pronounced your last name correctly, Carol. Welcome.
Yes, thank
Yes,
you.
Liz. If I can just give a brief introduction, I know that I've tried to keep you all aware of the various stages of the plan as we're going through it, and Carol's going to talk about the study which you all have received, and I did not get any initial questions back, so now is certainly the time to get the any final questions about how that study was done. And you see that I also have a 2-page handout, considerations regarding the personnel study. Some circumstances changed while the study was going on. There are some particular questions of seniority in the town that I've addressed. Very few of them. I think there's 3 of those, and then a couple of positions were listed for fewer hours than are actually worked. Some positions were listed for more hours than are currently actually worked. So I have adjustments up and adjustments down, and then proposed additions. And I'm hoping we can go through that document in more detail after she presents it. But lest there be a vote to accept the results of the personnel study before we've looked at the potential amendments, I thought I'd mention that now. And with that, I think Carol, if you'd like to go through the study, I believe everyone on the select board has gotten a copy of that.
Okay, thank you so much, Tom. Good evening. It's a pleasure to be here and present the pay and classification study report to you. I'm very familiar with your area. I actually was born and raised in Pittsfield, Mass. So I know the whole area and have been back frequently with relatives and such. And Dalton is certainly a nice community. This was an important project for the town, and it provides you with some critical information. and a system that will help the town to move forward and maintain a positive system that will both retain valued employees as well as assist with recruitment of positions in the future. We started the project in late September and concluded in December. Employees of the town are the most important asset, and moving forth with the implementation of a study also provides current information to assist with future union negotiations and recognizes the importance of all the employees. You have several union contracts as well as some individual contracts with employees. And I want to thank the leadership, your town manager, Tom Hutchinson, and his assistant, Alyssa Machino, who coordinated various interviews that I conducted with all your departments. And it was, and providing information we needed during the course of the study. You have a talented, dedicated workforce, which was very evident by the positive involvement of the employees through the process that I spoke with. The project goal was to develop a pay and classification system based on both comparative analysis and best practices for both recruitment and retention of 44 union and non-union classifications that impacted your 63 employees. The study provides recommendations for a compensation program that will assist the town maintaining competitiveness and ensuring equity. The information can be utilized to assist with your unions as well. We used a solid methodology looking at the policies of the town, and I know Tom has been updating policies along the way, even through the project, regarding how competitive you need to be. We conducted job evaluation for both internal equity through a point factor rating system and looked at the external market for your salary data. We included job analysis of all positions through interviews, questionnaires, and job descriptions, and ultimately developed a new pay and classification plan that includes both your union and non-union positions. Of course, any implementation, and we determined in talking with the town manager that we would have one complete classification plan, and then you can work from that with your unions, you know, your contracts, as well as other individual contracts you have, but it was best to have everything in one place to look at. The process itself included interviews, questionnaires, some of the criteria we looked at for the comparable communities. We looked at benchmark positions, and we looked at population, income per capita, tax bills, and some other factors. You'll see in the report, we did include 5 communities there: Ashburnham, Great Barrington, Hadley, Merrimack, and Shirley. And we utilized some of that benchmark as well as other data we had available. The market data is included in your Appendix A of the report, and it's one source of information that we looked at that supports several positions are significantly lower than the market, such as your dispatchers. We also utilized a 14-point factor rating system for internal equity, and the town manager has a manual on that that will assist in determining where positions should be placed in the future. And the factors that we look for internal equity are on pages 8 of your report. Our findings and recommendations are included in the narrative of the report, as well as the supporting material in all the appendices. The market data is in Appendix A, which includes the communities we listed. We developed a classification plan in Appendix B, and this includes 13 grade levels with all positions. Appendix C is the new pay plan proposed, and this includes 16 steps with a range from minimum to maximum of 30%, which is in line with best practices. This plan has, which is a different system than what you currently have. It has annual steps instead of utilizing what you currently have. They're basically holding steps. Some will have to wait maybe 2 years before they move on to a next level. The current system only has 7 steps. And the difference between the steps in the new proposed system is 1.75% versus what you currently have with the holding steps. And this is more common and comparable and competitive in the market as far as on an annual basis. Plus, you can budget accordingly because it's a little easier to budget from a town standpoint. Now, the estimated cost for implementation we determined was, and this may change. I know Tom has had changes back and forth with some positions, but at the time we did this, it was $57,906 based on the data we had. And that includes placing all positions on a step that provides an increase in pay, not a decrease. So it's closest to where they fall. 38% of the workforce will be moved to step 1 to meet the minimum rate in the proposed grade level. And this in itself indicates the need for increase in pay because this means that 38% number of employees don't even meet the basic minimum. So it's critical that you move them up. The cost to implement this doesn't take into account any performance, longevity, or other factors the town may want to consider. And I have provided some options and spoke with the town manager about this, that the town may want to implement and consider on pages 11 and 12 of the report. To recognize longevity, for example, would assist with eliminating any compression issues. And the compression issues are you may hire someone that has experience, et cetera, and you place them on a particular step, which may be close to someone who may have been there 15 years. And that creates morale issues if you're hiring someone in particular from the outside coming in when you have people that have more experience there. And I believe the town manager and treasurer may be exploring some of these options to consider. There are various options you can do to budget accordingly. During the course of the study, different reorganizations were discussed, or some actually implemented during that time period. And I believe there is even a potential one I noticed on your agenda regarding having the Department of Public Works being discussed, moving to having that department. And the study provides the town with the tools to assist with such reorganizations that may impact some positions. And I have to tell you how impressed I am with your employees, because during the interview, and I interviewed all the various departments, they were all extremely competent and dedicated and involved and participated very well. We utilize interviews, job descriptions. We're preparing all new job descriptions, and those should be provided to the town separately, probably in the next week, of all the positions. And they're all in a new format and in a Word format, so they can easily be updated or modified as things change. So it gives you a good basis. As I indicated, we've included all positions in one plan with the grades and steps. And you can use that as a basis, whether you pull some out and have individual contracts, or in updating union contracts to address some of the pay proposals there to implement any of the recommendations. So in conclusion, the study found that in many cases, the salaries of several positions are low, and the proposed classification and pay plan will assist both in retaining and recruiting positions. Now, I will say, as you're all aware, you always can find with some positions much higher salaries, even with a study like this, that people may go to, whether it's a very rich community, could even be smaller. We've seen that in your area, or some positions. Sometimes we see police officers, if they're in a smaller community, they want more activity, more action, so they may want to go, even if you have great salary and benefits. You do have the combination with the benefits you provide as well as these proposed new salaries, I think will help tremendously. And additionally, with changing to annual steps is an improvement. So in addition to adopting and implementing the pay scale employee increases, I would encourage you to consider, based on funds available in your budget, additional recommendations the town may make for a future system of addressing some of those. We've placed everyone on steps, but it doesn't take into account how long they've been with the town or any other aspects. So with that, I'd be happy to answer any questions you may have about the report or the study. And hopefully we'll be able to give you some answers.
Anyone from the board? I have a couple, but I'll defer to the other board members.
Tom, has there been any input from the employees on the job descriptions? Any feedback from them?
They're going to be provided this week, so there may be additional feedback. We're just finalizing them to have them all done, so we don't have the feedback from that yet.
When you say there's 13 steps that are done annually, does that mean at 13 years they max out on their steps?
That would, well, you would max out on the steps, but you should be increasing that annually with cost of living, so your pay scale continues. And down the road, if things would change, you could always add additional steps if needed, but that's a fairly common. Some currently you reach the top in probably 7 years or 8 years. So this provides a little more growth, if you will. But if someone started today and they didn't have a lot of experience, they started at step 1. And if they went annually, it would take them 13 years to reach the top.
Yeah, I'd be interested in adding some steps for long-term employees that have been on for about 25 years or so, 20, 25, adding in a couple more steps for that. Those long-term employees that have been here, like I said, 20 or 25 years.
Yeah, and that can always be adjusted down the road, but this gives you a good basis.
Any other members?
Yeah,
Mr.
Joe.
Oil? Yep.
Yeah. Carolyn, or just possibly Tom. As you stated, it's costs $58,000 to implement this. Now, some mechanics. It's this board, the board votes to implement this pay scale, salary compensation package. That would take effect July 1st.
Yes.
And that those appropriate amounts would be included in the departmental budgets to cover the salary requirements.
Yes.
Okay.
That's why we're bringing this to you now. It's just completed, but we wanted it to be done in time for the budget work.
One step further, Tom. In one of your communiques, I don't know what I did with it, but it stated that, yes, everything you say here is absolutely correct. But it stated that this figure, 57,000 or whatever it would cost to implement it, will be in addition to the cost of living increase that the board traditionally grants to non-represented employees. And you stated that was 2%. Yet the last calendar year, cost of living was 6%. And that's the raise most people got that are Social Security or disabled veterans or et cetera, et cetera. So are we following that path, or are we locked into 2% raise before we implement the pay scale, new pay scale?
A couple of things. 6% is, of course, an outlier so far. And my personal feeling is that stability over time is a good thing. With the annual steps of 1.75%, if the 2% cost of living gets added in, that's 3.75%. So that would normally be the rise per year as long as we stuck to this program. I agree, 6% is a lot of money, but I think that if we establish this 2% on top of 1.75% step raises, that will over time bring people up to where they ought to be. Inflation will again come down under that, and it'll be a much more stable tax situation for the town.
I'm not certain I can agree with that. What you're saying is we're going to trade off the salary institution of this schedule in lieu of giving you a true cost of raise increase, which is 6%, 5.9. That was what they gave us Social Security recipients, and like I said, disabled veterans, et cetera, et cetera. So, I mean, that sounds to me like what we're going to do here. That's why I asked this question, that we're going to trade off a true cost of living increase for this salary package, which somewhat waters it down and negates it in my mind.
Yeah, I understand where you're coming from. To my mind, and you've been around a lot longer than I have, the town has given 2% per year as a cost of living increase for a number of years in a row now. And I was assuming that policy would be maintained.
Well, Tom,
more is always better.
Fairly accurate, but that's when the cost of living was 1%, 1.5%, or maybe 2.2%. So for the last 5 or 6 years, without an inflationary factor, that's what it's been. But that has changed now. Now we have a 6% cost of living in the calendar year and continuing into 2022. So I think we should give a true cost of living. The board should consider an accurate cost of living increase for the employees, non-union employees, and insert it into the budget and then apply the study.
I just would like to tell you a little few comments about what's happening out there. This is an unusual year because you're correct. Cost of livings have been much less in prior years. What we recommend is to go with the CPI. This year, more communities are giving more because of the cost in Social Security and the increase of the 5.9%. So you may want to, I don't know what your budgetary limitations are, you may want to apply a larger cost of living this year. I think the idea of having the step system, that goes up as part of it, a minimum of 1.75. But then on top of that, you could increase it to have it in accordance with the CPI, or this year is substantially higher to keep up with inflation.
Is different than the standardized federal cost of living increase.
Right.
So what is the CPI for calendar year 21?
I think that varies per region. I don't know what it is offhand.
Yeah, it does vary per region, depending on which region you're with. Usually the Northeast is what you would go by. But that's something you may want to take a look at.
Am I wrong to say, sorry, John, am I wrong to say that the cost of living increase is separate than what we're looking at right now with these steps? Right? I mean, so we do the steps, we can still vote whatever we want on the cost of living increases.
I think we should, Mark, I agree with you completely, but I think we should do that first. And apply it to all the budgets and then apply the study. I guess there would be room for compromise. We could vote a 4% the cost of living increase. And then with the added incremental, you gotta remember, everyone in this study doesn't necessarily get a raise. So if you didn't have a true cost of living increase inserted in the budget, some employees would come out with nothing.
Well, the way that I've structured the proposal in the accompanying piece, I'm assuming that for FY23, everyone would get a 1.75% step, because the figures in the study are for FY22, because those were the figures we were working with the comparable communities. The 1.75 plus the 2%, which is 3.75%. So yeah, completely up to what the select board wants to do. I was in my way trying to be somewhat conservative in my proposal.
Yeah. And that's good to be done. I mean, I don't want to prolong the discussion, right? And I'm in favor of it. I vote to accept it if we voted right now. But I think we should establish the cost of living increase, we want to give grant to non-represented town employees, and then apply this on top in the budgets, and then take it to the town meeting.
Can we
If we-
decouple the vote for the compensation plan overhaul from the cost of living adjustments?
Yeah, we can't vote on cost of living because it's not on the agenda, so we have to defer that. So we can just kind of take Mr. Boyle's comment on cost of living. Let's, we can put that on a further agenda, and I'm going to make a recommendation that, well, let me ask a couple of questions first. Carol, there's a couple of positions that the gap is pretty significant between if we look at the data points. So the top data point, is that the entry level point, or is that the average data point in the bottom?
Yeah,
data
it's
point?
the minimum and the maximum. The top is the minimum and the next is the maximum. So that shows the range.
There's some pretty, and there's a couple, one in specifically that I won't call out, but I think you'll know what I'm talking about. There's one data point is about 115% difference. So I'm hoping that we get more data points for those positions that have less data points, so we can see more of an average and more insight into that. And the other thing, for Mr. Hutchinson, when I read your memo, the one thing that I'm concerned about is, although there's some employees with individual contracts, I think there's a pretty significant gap in what the analysis is showing, that we may want to consider that gap and not wait for the term of a contract to expire. And I'm specifically thinking about areas where there's a 30 or 40% gap, and it's pretty easy to move on to a lateral position in another town within the term of the contract. So I would just be word of caution on that, or just thinking through that a little bit more. And last is, do we have finance committee insight into this analysis yet?
I had invited Bill Drozane onto the call. I'm not actually sure he got the Zoom link, but it's available on the website on MyTownGov. I was hoping he would be here this evening. For the highs and lows of the positions, there are some substantial differences. This is one of the problems, is that positions are not, by any means uniform across the state, and they can vary considerably. But maybe Carol can speak a little bit more to I believe we got 5 responses for most of the items in that spread. So you're only seeing the top and the bottom. You're not seeing the middle ones, but that's included in the average that's worked out further to the right on the sheet. Is that right, Carol?
Yes, yeah, we have that, and it's on the market data report. It lists the communities. And as you can see in the last column, there are substantial differences on some positions. When you see the minuses, those are the ones that are substantially lower from both the minimum and the maximum, some being more so than others, and vary. And so that's one piece of information we look at when we develop a plan with that. So you do have some that clearly are significantly lower. And to your comment regarding contracts and such, we have them all listed, but I would anticipate you would probably want to make some adjustments with either individual contracts or with your union if it's something that's substantial, rather than waiting. I don't know the parameters of your union contract, but usually if there's agreement on both sides, you can open up to discuss one aspect of it to make a modification.
Yeah, and the other thing is, there are a couple of positions here that only have 1 data point or 2 data points.
Right, and those are ones that most of them have more. Some are either uniquely different or they didn't have anything comparable. So with that, we take a look at both from the internal equity as well as best practices, and then come up with where it's placed, should be placed in there. But if things change dramatically, you know, they can be modified accordingly if some are felt they should be at a different level.
And do we have a recommendation where we should land on the 75th or the 60th percentile in the market? Because I think that's one of our objectives, is to become a town that is equitable compared to other towns surrounding where we are.
Yeah, we had based this on the 60th percentile. If you want to go even higher, that would be the 75th. Previously, most were going to the average, but during this last year and a half, many have increased to a higher level. So this is based on the 60th percentile.
Okay. Thank you. Any other questions from the board?
Joe, just one quick question.
Well,
Carolyn, I may have missed this, but how do we address positions in the town? Like, we have a sealer on weights and measures who gets a stipend, and a tree warden who gets a stipend, which is a flat amount every year, you know, $2,000 or $3,000. If anybody deserves a raise, probably some of those people do.
Yeah, we did take in the market, we did get some comparisons on that as far as those positions, and some continue. Those are typically many places done with a stipend. That's why there's not a lot of putting the ranges in that, but that's something, if you continue with the stipends, you should address those accordingly too, as far as a potential increase.
Is that something that the town manager would recommend to the board or the various budgeting departments, that these type of positions be granted a some kind of equivalency rate increase?
Happy to do that.
Thank you, Tom.
other questions from the board?
This is more of a general comment to the board and residents who are listening. You know, as the cost of employee compensation and benefits increases year over year, I would just urge town manager and elected officials we really need to do our due diligence to find other ways to save money to pay for these things. You know, taxes will continue to go up for residents if we don't keep an eye on these increases, and we need to be mindful of that. But I'm definitely in support of raising our wages and compensation.
Well, I'd like to recommend, with this good work in front of us, and thank you, Carol, and to echo your comments, thank you, Mr. Hutchinson, and our team members who are participating in this process. It's, I think it was very well done. Questions about some of the towns that were picked, I'm sure there's reasons for that. But what I'd like to do, I'm not comfortable having further debate with this unless we have our finance committee review and assess, and maybe help, answer some of the questions that Dan has also raised of how do we, look at things across the board and the impact. I do think that we need to get to that 60th percentile, but I'd like to propose that we approve pending recommendations and approval from the finance committee, if that's appropriate. I just would like their insight in this before we as a select board take action on formal approval. But that's just my 2 cents from this discussion. Thoughts?
Yeah, my only concern is that we're going to be sending out the budget sheets in the next week or two. And they'll have to have something to base their salary on. So if you're okay with me giving that as a tentative yes to these particular items, and perhaps the adjustments that I mentioned in my short paper.
Yeah, I'm not sure I'm in support of the paper yet, because the question of individual contracts, we haven't solved that yet. Because your recommendation in paper, if I read it correctly, not limits us, but says let's address that at the end of a term. And some of our employees are 3-year, a couple of new ones that have joined in the last year in 3 or 5 year terms. So it's a pretty long time to wait. But that's just my question.
Yeah, and that's fine. That's actually, in my mind, that's actually a separate discussion because, you know, we go by the contracts until we don't. So if you want to start separate discussions about that, then that's fine too. We can have those negotiations in an executive session.
I'm going to defer to other board members, but I prefer to wait until we have finance review. But I'll take a motion if there's one on the table.
So the finance committee has not looked at this proposal yet?
I've sent it to the chair. I don't know the extent to which members of the finance committee have looked at it. But again, if people are going to start, yeah.
When's, Melissa, do you know when the next meeting is?
I believe they just had it, didn't they, Tom?
They had a meeting to start organizing for the budget season, yes. And I don't know whether this was discussed or to what extent.
Should we have a joint meeting with the finance committee on this?
Yeah, we could call a special joint meeting. We just need the open meeting law parameters, right, to have that.
Right,
Yes, and I had suggested that for this meeting. And the finance committee chair wanted to have his own meeting first. And for whatever reason, maybe we just didn't get him the information, but he's, you know, not present right now to speak to it. My concern is that departments are going to have to start filling out their budget, and it would be helpful for them to have some figure to work with that might be amended later.
We've had years in the past that the pay rate increases, both union and non-represented employees, hadn't been formulated yet or decided on or agreed to by the time we started asking department heads for budgets. So they just concentrated on the expense budget, the expense portion of the budget, and left the salary part unfilled until the issue had been resolved.
Yes, and that's how I've gone ahead this year. I'm just cautioning that waiting for another body to make a decision, certainly to have input would be great. Certainly to have input together would be very good. So I fully support that. I just think we can't let it go on too long without being resolved, because we do need to do the budgeting.
If there's no objection, I would be happy to reach out to Bill and try and get if everyone's calendars allow, to have a joint session. It would be probably we had to post 48 hours in advance or 72.
48.
48.
48.
Yeah.
So we could have if we could get calendars lined up, we could have a session Thursday night or Friday night or next Monday, a joint session, because I think it's a very important decision, because it's a big impact at the end of the day. It's a good impact, but it's a big impact.
Joe,
Yes.
He may very well want to, as has been stated, has his own private, personal, or their own meeting beforehand, before they dive into a joint session with us. Just something to consider, that's all.
Yeah, and that's a conversation I'd have with Bill, is how do we line this up, because of time.
And I also think this board, the board, I sense, supports the pay proposal. So we should have maybe indicate to the finance committee that we strongly support it, or leaning towards support it, or at least have a position so they know where we stand.
We could take an endorsement vote.
We didn't even look at it.
Yeah. I'll take, if there's a motion, Mr. Boyle, to endorse it and submit it to the finance committee for review and then joint discussion, I think that would be fine.
I make a motion that we do accept this proposal of the wage increase and send it to the finance committee for further review.
Second.
Motion second. Any further discussion?
Tom,
Hearing none. Yeah,
what kind of
Mr. Fresco.
timeframe are you looking at in terms of a final decision so department managers can plan and finish the budgets for 2023?
Absolutely.
Great question, Mr. Hutchinson.
Yeah, I would say no later than the next regularly scheduled select board meeting. At the next meeting, I will be presenting budgets for my own department, and some others will be presenting as well.
So that's in 2 weeks, right? 2 weeks
Yeah.
time? Yeah, I think that should be doable.
So we have on that agenda for that night, a item that indicates the board's preference for a cost of living increase.
Yes.
So, so there's a motion from Mr. Bishop, if I'm paraphrasing because I didn't write down exactly what you said, but it was a motion to,
Ask me.
go ahead, say it again, Bob.
Oh, I can't repeat it. Let's see. I make a motion that we accept the proposed wage increase and send it to the Finance Committee for their opinion and for further review.
And have a joint session.
Have a joint session with them, yes.
Motion, is there a second? I think Mr. Strout seconded that.
Second.
Okay,
Second.
thank you, Mr. Strout. And a motion, a second, any further discussion? Just one question for Carol. An ask I would have is that those positions only have one data point, especially where there's a pretty big gap. If we could have a couple of data points or more analysis of that particular position, that would be, I think, helpful. Because I thought I saw a pretty significant gap in one specific one, and it just had one data point. Any further discussion? Is a motion and a second, roll call vote?
Joe Diver,
Yes.
Mark Strout,
Yes.
Dan Esco,
Yes.
John Boyle,
Yes.
Bob Bishop.
Yes.
Great. And Ms. Hutchinson, I'll take the lead. I'll CC you on that to get Bill Drosheen and the Finance Committee together. And so you'll see that communication come out this evening.
Thank you.
Yep. Great. Thank you, everybody. And Carol, thank you again
Okay,
for
thank you.
the great work. Yeah.
Good luck with it.
Thank you.
Thank you, Carol.
Thank you. You're welcome.
You autograph this for me?
Number 9, the proposed department reorganization and Department of Public Works. Mr. Hutchinson.
Yes, I'd like to ask the date of the document that you have before you.
December 29th, 2021.
December 29th.
Yep.
Okay, I'm sorry. I had done some revision of this, and I'm now leaning against trying to incorporate the building and grounds position in there. I've sent out questions to other town managers and administrators and gotten a variety of responses to it. And in fact, there's one town, Lunenburg, that's actually removing their buildings and grounds from their highway department because the nature of the work is not quite as closely connected. And although there are many similar functions, the buildings and grounds tends to be discrete. That is easily separated from the other. That said, the main goal of this is to consider transferring the operation of the transfer station to the town. And I set down a variety of reasons why that might be a good thing. It boils down to Casella doesn't want to be in the business of operating the transfer station. And Jane knows more about that than I do.
Did we lose Tom?
And
Oh, there he is.
for their business model. Did I freeze?
Yes.
Yeah, we did for a quick second. You're loud and clear now, Tom, so we're good.
Okay.
Said Casella was uninterested. That was the last.
Yes, okay. And we know that they're making a profit. So if we stuck with the same cost of things, presumably it would continue to pay for itself through stickers and bag fees. What we would gain would be the ability to do more things with the transfer station. And Bud and I have talked a little bit about that, and Jane, for the possibility of additional drop-off functions from clothing and shoes, a swap shop. We would also get the revenue from the metal recycling and the plastic recycling. And this started being driven by the fact that we're renegotiating the contract with Casella this year for FY23. And again, Jane can jump in a little bit there. We're going to be meeting with them to discuss the you know, what they would want, what such a change would mean for them. So that's the argument in a nutshell. I think it would be more than cost effective, and I think we could provide better service to residents. And so that's, and Casella doesn't want to do it anymore. So that's and again, we'll be talking with them. Is that this week, Jane? I think, yeah.
Yep, we'll be talking to them on Thursday.
Yeah, so that's the real issue behind making the department into a DPW, having them run the transfer station.
Tom, my question is, number one, did we do a cost analysis on taking that on yet? I mean, is it, I understand if we take this person on, we're going to have to pay this guy benefit or this lady benefits, whoever is there, and we're going to have backup for them. And they become, they're going to have to get vacation pay and stuff like that, which we don't do now. And plus the fact that Casella, we kick them off without really getting their opinion before we move on this. They can pull their equipment. They own the equipment out there, do they not?
Yes, and one of the things we'll be discussing is the disposition of the equipment. A lot of it's old, some of it will have to be replaced soon. So that would be an additional cost to the town to replace, say, the main compactor, which is probably 30 years old at this point. That said, again, they're not losing money on what they're charging. And I just got the figures. We just got the figures from Jane, which I have not looked at closely, but it looks pretty good. And of course, Casella pays benefits too. And I think Jane or Bud may know more about the benefits Casella's paying. The fellow's name is Brian out there now.
Yep. Let's, if we can put this on a future agenda, because we're kind of getting outside the scope of the question of DPW and getting more into the transfer station itself. But I would recommend to the board to look at the minutes of the Board of Health, because I think they're doing some very, very innovative thinking around the transfer station itself. And I think it's a big, solid story that comes forward. Jane?
Thank you, Mr. Diver. So yes, actually, it's our solid waste committee had a great conversation around it at their last meeting. And then I've been doing a lot of cost analysis. So hopefully, you know, if we did put this on the next agenda, hopefully we would have a pretty good idea of not just the income, which, you know, just from the solid waste stickers and bags in 2020 was almost $160,000 that got brought in. That's not bulky waste or anything else. And we'll have all of those figures, but also we'll have an idea whether they want to sell. Casella would be interested in selling us the equipment. We're having someone come in and do an assessment of the equipment. So our last waste management and recycling meeting was was very dense, and we made a lot of progress towards, kind of figuring out what the process is to get from here to where the town wants to be in 6 months. That is, have a clear path for their solid waste.
Let's put that on our, I'll propose our agenda 2 weeks out. Is that our next meeting?
Mr. Chairman, can I just say one thing before? I agree with you.
Sure.
2 weeks. Tom, I think your figures and way of comprehending the situation over there is a little bit fuzzy. I don't think yourself and Jane have a real solid picture of that operation and what it entails. You've indicated you have no idea how many sticker buyers there are over there.
Well, we can't discuss this because it's not on the
No,
agenda.
okay,
So,
okay. That's
yeah,
a
we need to
rhetorical
defer.
question.
Yeah,
And
there's a
so
lot-
I'm asking
there's
for
a-
in 2 weeks, in your
Yeah.
proposal, you come back with, and I agree with Bob Bishop completely, have a strong top to bottom cost comparison analysis of what we're doing now and what's being proposed and how much it's going to cost the town or the sticker buyers.
Yeah, this is I think there's a lot of residents interested in this discussion,
Yeah.
so let's defer.
Because their
to,
sticker
2 weeks
price
out.
went up from $80 to $122 in 4 years.
Mhm.
So I think that's the issue we have. We need perhaps we need to get an accountant to figure in such things as workman's comp.
Well, let's
deploy.
yeah, I would like to let's defer for 2 weeks. And Mr. Hutchinson, I'm going to send you an email with minutes from a conversation that this board had about 2 years ago on this topic, so you're aware of those decisions that were made and the guidance. And then we come back in 2 weeks from that. So, but we don't have this clearly on the agenda, so we need to pause this conversation. Kind of.
Well, it is on the agenda, isn't it?
No, it's not. It's not.
It's listed on this proposal at Department of Public Works as considerations and proposal for town operation of transfer station.
It's not on the agenda that's posted. It's not on the agenda that's posted online.
Yeah, I understand that.
Then why is it on my?
So are we just not talking about any of this at this time?
Proposed Department of Reorganization, Department of Public Work. It's not clearly that we're talking about the transfer station operations.
That's not clear part of the proposal, though.
Yeah, it's not clear to the general public.
Yeah.
Okay, my apologies for that.
This is the first, obviously I got this meeting information recently, but it's the first I'm hearing about the reorganization. So I think more time's needed. I have a lot of questions about the document, but I don't know, I'm just not sure exactly what we're talking about at this point.
Yeah.
And I urge everyone to get me comments and questions before the next meeting.
Can I ask Bud a question, please? Bud, what do you think about all this? I mean,
I don't think it would be crazy difficult for us to take it over. I mean, I think most of it, not so much with the gentleman here, but before I left and was gone for a couple of years when Scott was there, we did a lot for Scott, like compacting the dumpsters and moving things around and this and that. So we would help them a lot move the dumpsters because they, Casella would drop them off crooked. We'd have to help them set things up, and all sorts of things. We kind of helped a lot. So for the most part, we've been around there a lot. It'd be a little bit of work, it'd be calling the trucks to come move things a little bit, but whatever person we get in that position, I think they would be able to do such things. And I don't think it would be so difficult. This is when I was at Hinsdale, actually. They run their own transfer station in Hinsdale. So this is pretty much similar to what they do there. And it ran pretty smoothly up there. Every week, everything was pretty smooth. And it really didn't seem like it was that awful. And they had the swap shop, the whole, 9 yards up there, I guess you could say. But, I don't think it'd be a horrible addition for us at the highway garage or Public Works.
all right, thank you.
Yeah, and my apologies as we looked at the agenda to not have these clear bullet points on that agenda so we can have that broad conversation because it's pretty good stuff in that document, but I think we just need to make it clear that for the agenda. So with that, we'll defer that for 2 weeks out and come back and have those on the agenda and then go through the detail, and we can, Mr. Hutchinson, you can make your adjustments in your DPW proposal regarding buildings and grounds. Any objection to that?
No.
See, next one, accept a grant from the Central Berkshire Fund, the Fund of Berkshire Taconic Community Foundation, in the amount of $4,852 to the Senior Center to improve technology. Mr. Hutchinson.
Yes, I was not directly involved in this grant proposal, but I know Kelly's excited about it, and they've offered us some money, so I appreciate the select board accepting it.
Your motion.
Yes. I make a motion, we accept the grant from the Central Berkshire Fund of Berkshire Taconic Community Foundation in the amount of $4,852 to the Senior Center to improve technology.
For a second.
Second.
Motion is second. Any discussion? Hearing none, roll call vote.
Yep, Joe Diver,
Yes.
Mark Strout,
Yes.
Dan Esco,
Yes.
John Boyle,
Yes.
Bob Bishop.
Yes.
Great. Let's see, moving to Board of Health update. Jane?
Thank you. So really what I wanted to report out to you is just that our numbers are continue to skyrocket in Dalton. I was trying to find the most recent graph that I had done. I'm on the wrong account for that, but you know, we're looking at case numbers, whereas last time this year we were looking at 33 in the last 3 weeks. We're looking at cases closer to 120, 130 in the cases in the last 2 weeks. Those are only the PCR tests. Those do not include rapid antigen tests, nor does it include all of the home tests. On the line actually is Agnes Witkowski. She is Dalton's new health agent, and we are working together. And so I'm going to give her the floor. That's kind of my contribution. She's been working very hard with town departments as well as the public, and I would say it's hit the ground running. So Agnes, do you want to give up a little COVID update?
As far as the state, as far as CDC and the state has updated guidelines, they've changed the guidelines for isolation and quarantine. They've reduced the amount from, in certain situations, from 10 days to 5 days. Besides, that's for the general public. DESI's also updated their guidelines, sort of matching that, and healthcare workers have been changed as well. All those guidelines are out on the Dalton website. Alyssa updated them today, so thank you very much, Alyssa. And what just came out today was that they're extending masks for elementary and secondary education for the students to be wearing masks in school until February 28th. So that guideline was just extended today. And as Jane said, I think we're in a situation where there's a rise in COVID. So just be mindful of that.
Agnes, do we have a handle on what age group is really affected in this, or is it kind of like everybody, or is it just a certain age factor, or is it the kids in like junior high school or Craneville?
What I did notice, I think that the younger kids right now are higher. Are you saying a specific? If you look at mass.gov, you can actually see across the state, everybody's higher. I mean, Berkshire is 9.88 for positivity rate, but there are even counties that are even higher than that. Let's see if I have it right now. And as far as the age group, specifically in Dalton,
yes,
I think that was Jane. I think you had that information, but we don't have that graph available right now. Right. And I could log on and log back off real quick and I'd have that breakdown. But yeah, so there's two different things. One is being infected, okay? And we're seeing a lot of breakthrough infections, as well as like a lot of breakthrough infections, but the difference is the severity. So like, if you have someone who's vaccinated, they might just be presenting themselves with a headache, maybe some cold symptoms, they might be really tired, but they're really not getting to that next level of ill, most of them. Whereas the unvaccinated, I think the Omicron is still possibly less, makes them less sick. The problem is that there's so many more people that if you do end up going to the hospital, it makes it a lot harder on the staff. The hospital staff is overwhelmed with like all of the normal stuff that they do, but then also with the influx of cases. And so with Omicron, really the difference is just that the people who are going to get sick, which are mostly immunocompromised, over 65, right, unvaccinated, those people, still have a risk to go to the hospital, and we're trying not to overtax our healthcare system. I do have a breakdown, and like I said, I can hop off and hop back on, but really across the board, there's no demographic that is not getting cases. I think we have had a couple of preschools impacted by COVID in the last week. And that's really hard because those kids are not masked, and it's really hard. Social distancing and all of the things that the schools have gotten really good at are harder in a child care setting. And so we continue to work with them and be a resource to them, as well as providing our public health nurses help the preschools. The contact tracing is really happening on school age and preschool children and the elderly. Those are the priority populations that are getting reached out to. So that's a big change from earlier on in the pandemic. Like last year, if you had COVID, chances are you were going to get a call from a public health nurse. That's not necessarily the case anymore. And people are being asked to contact their own close contacts. And that's just because of it's a matter of just the sheer volume. The public health nurses that we have in the county just simply can't keep up necessarily with contacting every single person. Did that answer your question, Rob? Bob,
Yeah, you don't need to give me, go through all that. If we can get a sent to us at some point, that'd be great. But yeah, I'm just wondering if, because of the holidays are over, if this thing's going to start peaking out, because it seems like right after Christmas we had that big upswing, and then right after New Year's we had a big upswing. So
just from my day job, they're projecting that the numbers are going to start coming down a little bit later in January into early February. Most of the hospitals across Mass are over capacity, but now they're going to start reporting their numbers differently, because COVID wasn't the initial chief complaint about the patient coming to the hospital. It was some other surgery or some other slip and fall. They weren't symptomatic, but they got a COVID test because that's just standard protocol, and they're positive COVID, but they could be asymptomatic as well. So there's a lot of different things that are moving along in that space.
Actually, this is Agnes, and I'm just pulling up mass.gov. And if you go out on the mass.gov COVID-19 interactive dashboard, it actually gives you a breakdown of the confirmed cases. The majority of the cases are the ages 20 to 29, where it's like 33,338, 30 to 39, 27,456. There are some, so that's, even 40 to 49, 19,000, 50 to 59, 16,000, 60 to 69, 9,000. But when you look at the graph, you can actually see 20 to 29 is definitely a high number.
Helpful.
Yeah, I hope that answers your
I have
question.
the ability to share my screen now. If anyone knows how to let me do that, Alyssa, you can also click on the three little dots and make me a host really quick. And I can give you guys the graph of where we were last year versus now.
Or the host.
Okay. So this is how I keep track of the cases. So you can see that I've looked through January 6th. And so what we have here is this graph. So the dark blue right here is where we are now, right? So we're like 130 something cases in the last 2 weeks. Last year, this time we were at 50. Okay. For the last 7 days, that's this darker gray line. Looks like we were about 70, and versus last year at the same time we were about 30. So you can see it's significantly more like last year over this year. What I think Mr. Diver was talking about is, and then this has happened in South Africa, is that it peaks and then it burns out and it can fall quite precipitously. And that's what we're hoping will happen with this Omicron. I mean, it's not, it's very contagious, but it's not as severe. So, you know, this might be leading to a new chapter. And so this is just the data from July 15th of 2021 to now. So you can see but though it's a huge difference from last year. On this next sheet I have here, this is the cases. I think it was from right before Christmas till now. It was a 2-week period. So you can see kind of the breakdown. It looks like actually the group that was most affected by this period is 36 to 55-year-olds. And so, you know, when we send this information to the school district so that they can kind of match it to see what they kind of have. This is, I think, what you were talking about, Bob, like which group are mostly impacted. It looks like really 36 to 75. So it's, you know, it's old people like us that are getting impacted.
We better behave ourselves.
Yeah, and Jane, that data is missing anybody that felt symptomatic and took a home test and was positive, like myself on Christmas Eve.
Absolutely.
Not only is it anyone taking a home test, but also even the rapid antigen tests. So like when Agnes and I go out and we have these kits of 40 tests, and we can, you know, we've been using them especially for the town functions. Those, we report those to the states, but this does not represent that. So if you have 128, you can guarantee that there's plenty of people testing at home that aren't with those rapid antigen tests. And so this number is probably a lot higher than this, at least double, maybe triple what the actual cases are.
Wow.
Yeah.
Okay, thank you. Thank you, Jane.
You're welcome.
Jane, how much longer do we have you at the Board of Health? You're helping us making the transition over to Agnes, and Agnes, we're thrilled that you joined. But just want to make sure that we, you know what's going to be the formal last time we see your smiling face on one of these meetings. So
the last time, so I've agreed to stay on through January. And so I think the first month or the last Monday in January will be my last day. I think it's maybe like January 27th or something. And so I'll be here for the next meeting. Actually, we'll have lots of things to talk about at the next meeting. Just trying to wrap up things with solid waste, as well as, you know, trying to get Agnes exposed to as much of the topics that Board of Health works with, and then also signed up for, like, for instance, that data that I just showed, there's actually quite a process to have access to that. And so, you know, those are the types of things that we'd like to be working on. And there's plenty of times that we're just working on putting out fires here and there, answering questions. Agnes came on right as the guidance changed. So I would dare say that she knows the guidance better than I do. So I feel like you'll be in good hands.
awesome. Thank you both. Thank you both for a great update.
You're very welcome.
Yes, thank you.
Moving to number 12. Well, let me pause. Any other questions from the board for either Jane or Agnes? Okay. Hearing none, thank you both. And then moving on to number 12, just a quick update here about the Central Berkshire Regional School District regional agreement. So I'm involved in that agreement review along with the other members of the 7 towns and a couple of school committee meetings. I just want to say thank you to Mr. Locatell and Mr. John Bartels for helping kind of guide us through our review of the agreement. as we prepare for these other meetings that are up and coming. And Bill Droshin is also joining me on this committee. Our next meeting is on the 12th this week, and we're going to be reviewing the first 3 sections of the regional agreement, which has nothing to do with a financial perspective, but just much more around organizational structure and things of that nature. But the committee so far is working very well together. We set some good guiding principles of how we collaborate and how we kind of think through these. There will be some challenging conversations coming down the road for sure. And we'll cross those bridges when we get there. But what I want to do is just keep this board up to date on that activity. No major decisions at this point. I think these first 3 are pretty straightforward. And but I'm receiving advisory from Mr. Locatell, Mr. Bartels, and Bill Droshin as we navigate through this. Each town has 2 voting members on the process, and what we've agreed to in our last meeting is for the 7 towns to accept the regional agreement. It will be 5 out of 7 towns, and then it will go to the school committee for full vote. And then it kind of follows its process through town meeting vote as well. So we're on a little bit of a journey here. We don't anticipate that this will be ready for town meetings this year. So probably 1 year out for finalizing anything within finalizing the formal agreement. So more to come, but I shared the draft agreement with all of you probably a couple of months ago, but I'll send you a fresh edited copy as well. If any board member has questions, certainly reach out and let's chat about it. And get your advisory on it as well. And I will bring, as soon as I know of decisions that are going to be voted on or made before meetings, I'll certainly bring it to this board for discussion and just share what our thoughts are in general to get your advisory on it as well. So that's the only update I have there. Any questions at all?
Yeah. Joe, quick question. Get any update on the status of Hinsdale any update on the status of Hinsdale as it pertains to their membership in the 7-town or 6-town Central Berkshire Regional School District?
Hinsdale or Cummington?
Cummington, I'm sorry.
Yeah. Cummington is active in this process. And there's been no
active in.
Yeah, active in they've been active in the school committee, very active in the school committee. They have 1 representative and very active in the regional agreement process. I'd say it's in a very positive direction that they're going to stay on board. I haven't heard of any formal discussions or agreements or anything else of that nature. But I see that Mr. Locatell has joined us in the public. So let me pause and see if Mr. Locatell would like to make a comment on your question, John. Mr. Locatell, if you can hear me, any thoughts?
Yeah,
There he is.
the answer as far as Cummington goes, is there's really been no activity recently, and I don't think there's anything going on behind closed doors either. There really hasn't been anything on their part for probably a year. The only people that raised the question of Cummington are people from Dalton. So, there's nothing to do on Cummington. We just ignore that issue for the time being.
I think it's very
Thanks,
positive.
Nick. I won't bring it up again. Let's sleep in dog fly.
Yeah, I think they're very positive engagement though from the Cummington reps for sure. So, okay, so I'll continue to bring those updates and reach out as we progress forward on that. It's going to be a long journey, but we'll get there. So, any other questions? No. Okay, I just lost my space. Oh, 1 sec. I just lost my my website with the agenda. Mr. Bishop, can I defer to you on what's next on the agenda?
Yes.
Fix this issue.
Town manager update.
Great. Mr. Hutchinson.
Sorry, I had to unmute. Thank you. Yes, I did come up with some information about the sandwich board and came up with a background piece that I forwarded to the ultimately to the planning board with the ZBA copied, as it's the ZBA that I mean, it's the planning board that is responsible for any zoning proposed changes. So I moved that forward as the select board had requested. And other committee news, I will be meeting with the Waste Management and Recycling Committee for the foreseeable future to work on the waste contract and do whatever might need to be done if the town if you guys want to move forward with the transfer station. And they discussed a plan. You may remember we got a grant, a small grant for a consultant to help out with that. And someone from Ty and Bond is giving us advice on the engineering aspects of what needs to happen there, because it's not in good shape, of course. So, and they're also potentially working on the next contract. So they came with all kinds of ideas and heard from the committee. The committee was disposed to be in favor of the idea of the town taking it over for the various reasons I think I've already articulated. But again, we'll do more on that next time with some good numbers for you. And for department news, I want to give a special commendation first to both Chief Strout and Communications Director Gabrielle Taglieri for their quick and effective work during the recent COVID wave that hit Town Hall. 5 out of 13 police were ill and 3 out of 5 dispatchers. Thanks to their highly competent organizational skills, the dispatcher's office was professionally cleaned immediately, and neither function suffered a loss, with state police covering Dalton shifts and 911 calls routed for a short time through Pittsfield. So great thanks to both of those department heads for excellent, quick, thorough work in that time of staffing crisis. I'm pleased to say we now have Jessica Soleski on board as administrative assistant for the highway department, with Heather Hunt in place as the new town clerk. I am pleased to say that Ms. Hunt has had her January 3rd grand jury duty postponed, but unfortunately it's only till April, which, as you know, right before the town election. I believe we will have to write additional letters at that time asking for a delay until after the town election and the 30-day state reporting period for town meeting. And as mentioned before, fiscal year 23 budget meetings are starting in 2 weeks. And I'm glad to hear that Chair Diver is going to be inviting the Finance Committee to participate in order for everyone to be able to hear the same information and ask questions and get the same answers. We got some very good news with the American Rescue Plan Act. That's ARPA money that the town received. They are now allowing, we didn't get $10 million, but if we had gotten up to that, we could spend it all on any regular departmental operation. The way that smaller pool of money is now, you can spend up to $10 million of your ARPA money for all of those purposes. That said, I think we have a good plan for now, but we do have more flexibility should we need it. And finally, I have decided, unfortunately, not to attend the Massachusetts Municipal Association annual conference on January 20th and 21st due to the increase in COVID cases in Massachusetts. I don't think we'll be down the other side of that slope, no matter how steep it is, by then. So I reluctantly pulled myself out of that conference. And that's it for me.
Another great update, and thank you, Tom, for acknowledging our communications department, police department on that change, because that was a significant hit, and absolutely agree. And also bowing out of the MMA meeting is also a great decision. I too will be bowing out of that at this point. Any questions for Mr. Hutchinson?
Yeah,
from the board?
Joe, I got
Mr.
a
Boyle.
question. Yes. Mr. Town Manager, Mr. Chairman, I'm hesitant to bring this up, but I think it needs airing. I heard on the street, again, just a rumor, that Sergeant Furlong has resigned from his post as Sergeant of Dalton Police Department. And I also heard that senior members or leadership members of the board were notified of this, and yet I wasn't. Perhaps you can confirm the fact that he has handed in his intent to resign or has resigned. And I think,
yes, I can confirm that, and I'm sorry for not getting that. I meant to include it in my report, but I've been away, unfortunately, and I did mean to include that in the departmental report. So my apologies for not including that.
Mm-hmm. Well, I think one of you or both of you or somebody should have some words commemorating Sergeant Furlong's career in the Dalton Police Department. I mean, he was a natural born leader, served several combat tours in Afghanistan. He was a major in the U.S. Army and in the Army Reserve. He recently participated in suppressing or working on the aftermath of the insurrection of last January 6th, then returned to Dalton duty. And it's a real shame. And plus, he had 20 years in the police department. And I'm certain he would have wanted to stay and finish his career here, but other circumstances dictated that perhaps he believed that this time would be better.
Well, why don't we?
The town of Dalton, I'm not done yet.
Okay.
The town of Dalton has lost a sterling police officer, and I think it notes some recognition. Thank you.
Well, why don't we put that in executive session to discuss that recommendation, and we'll do that in the next meeting.
Why is that an executive session matter?
I'm just thinking because it's an employee situation, that's all. And you probably have a lot of questions that we should probably discuss in executive session. So I'll defer to Mr. Hutchinson if that meets executive session.
Is there a letter of resignation?
There is.
Oh, can the board see it? Or I mean,
we'll bring that to
wait for an
executive
answer.
session. We'll bring that to executive session. Mr.
We
Hutchinson,
can't see it in advance, but you've seen it.
I haven't seen it. No, I know it exists. So, Mr. Hutchinson, can you evaluate if this is an executive session discussion for next meeting?
Yes, I'll let you all know. And I know that Chief Stroud got that letter of recommendation. I don't believe I've received a copy of it either.
Letter of resignation.
Resignation. My apologies.
Okay. All right.
Will we all receive a copy of that?
Sure. I think we can send that around.
Yeah, it's the first I'm hearing of it as well. Sorry to see him go. If this is something we should be discussing in executive session, I'm fine with that as well.
Any other questions for Mr. Hutchinson on the town manager update? Okay, hearing none. Future agenda items? Okay, hearing none. Items not anticipated 48 hours before the meeting. Mr. Hutchinson?
Nothing from me.
Hearing none. Remarks to the select board? Anyone?
I'd like to thank the town highway for keeping our roads nice and clean over the mess we've had here.
Yeah. Okay. For announcements, Dalton Police Department is reminding the citizens of Dalton of the winter parking ban, which is in effect from November 15th, 2021 through April 15th, 2022. There is no parking on streets between between 1 a.m. and 6 a.m. Following committees have vacancies and are looking for volunteers: the ADA Committee, the Beautification Commission, the Cultural Council, Dalton Cable Advisory Committee, Dalton Development and Industrial Commission, Dalton Green Committee, the Finance Committee, Memorial Day Committee, Stormwater Management Commission, Waste Management and Recycle Committee. If interested, please reach out to Alyssa Machino at the Town Manager's Office by calling 684-6111, extension 202, or emailing amachino@dalton-mass.gov. More information can also be found on the town website, dalton-mass.gov. Next meeting is scheduled to take place on Monday, January 24th, 2022 at 7 p.m. at the Dalton Senior Center, but watch for updates as we may stay remote. And with that, a motion to adjourn.
So moved.
Is there a second?
Second.
Second by Mr. Shaw. Any discussion? Hearing none, roll call vote.
Joe Diver,
Yes.
Mark Strout,
Yes.
John Boyle,
Yes.
Dan Esco,
Yes.
Bob Bishop.
Yes.
Great. Good night, Dalton. Thank you.